Hey, joining us on the program today from Cigna, one of the leading health plans in the space and one of the really early leaders in the whole CDHP space, is Ana Sabatino, who is the Regional Segment Vice President for Cigna Choice Fund. Ana, good morning.
Hey, good morning, Doug.
Hey, nice to have you here. So, hey, give our audience a little bit of background. I think everyone knows Cigna, the brand, but talk to the audience a little bit about the history of Choice Fund, and then we'll get into some of the experience studies and the results from those that you've done recently.
Sure. So Cigna has been in the CDH space for approximately 9 years. Our branded HRA and HSA is called Cigna Choice Fund, and we've spent the last 8 years really studying very intensely the population, our CDHP population, and really looking at very specific metrics to make sure that we are able to answer some key questions for our employers and customers relative to how these plans are impacting them relative to health and cost and kind of overall experience.
What are some of the highlights, some of the most interesting findings that that your survey is showing?
So over those last 8 years, we've seen very consistent results relative to three kind of major buckets, and certainly ongoing good positive results relative to costs coming down with that population relative to their cohorts in our traditional plans. We've also seen very positive results as it relates to the way individuals behave, so in particular the fact that they're using our tools and really shopping for services and looking for quality providers. That is an ongoing finding that we have over the last 8 years. And then, certainly the health aspect. So the real promise of these plans, and certainly from Cigna's perspective, is that we are able to show improvement in how individuals manage their health, and that health actually, by extension, starts to improve relative to very specific metrics. So we have seen that our Choice Fund population with these large population studies do demonstrate better health risk scores. So, overall, this has certainly been a very good results that we've seen, and we expect to see ongoing positive results.
Ana, this is Brent. One of the things that we always see in a lot of studies, your studies included, is that the CDHP plan piece is the one that's actually having the most growth. A lot of the other major medical plan designs are remaining flat to an extent. Is it because employers or your members, is it because they really needed to costs were getting through the roof and they really needed to put a plan in place that empowered their employees? Was that the bottom line?
Yeah, so I think there's been an evolution over the last 13 years with CDHP, and if I speak specifically to Cigna's book of business, we certainly saw a lot of employers jump in early on that were totally focused on reducing cost, and it still is a major objective for them. But I think more and more employers are starting to understand that they have to focus on the engagement piece and changing their culture. So CDHP becomes the chassis in which they really believe now will optimize other programs such as your health advocacy programs and the use of those key critical tools and resources that individuals need to use. And what we see time and time again is that individuals, when they're on this particular type of a model, are going to engage at a much higher level in those various programs and activities that we know are going to help them get to their end state of better health.
Yeah, Ana, when we formed the Institute for Healthcare Consumerism, our mission at that time was to really help this market build best and better practices around healthcare consumerism. And, we stated from day one that it wasn't just about the CDHP plan. It was really about the total scope of a true healthcare consumerism initiative and building better consumers of health and healthcare. And I think that's what you're supporting and what you're showing, through the experiences that you've had with your clients and the consumers.
Absolutely.
And now, do you, when you going back to your study, are you looking, across the board at your book of business from all different types of employers? So maybe a blue collar workforce, maybe a white collar workforce. Is it a blend of companies, or are you seeing that specific companies are moving more towards the CDHP offering as opposed to some of the other companies that might be in your book of business?
So I'm going to take that question into two steps. When I answer that based on the study, our study over the last 8 years has been pretty much focused on a designated group of employers, so a very large group of employers. This year it was 2,200 employers and 3.6 million individuals. So a broad cross-section of various industries are mixed into that 2,200 employer group. And in addition, we are looking at analyzing data for full replacement and option sales. So really trying to figure out what happens with these individuals, whether, the selection is an issue, or we just happen to have the right population in the study and therefore we're getting better results, or are we really seeing individuals that are behaving differently because we have someone who now is paying attention, becoming more aware and present in making decisions around their health. And again, what we see time and time again with these studies, as we look at these longitudinal database, is that not only do they engage first year, which you would expect when you go from a copay plan or traditional plan to a CDHP plan, but at renewal, the results get even better. So that's become kind of a big aha for Cigna, that as the populations have gotten bigger in these studies, that we really start to see much greater use of evidence-based care. We see significantly higher engagement with our coaching programs and our cost and quality tools. So, this is a different person, and they continue to be better consumers as time goes on.
Anna, when you look at the findings from the study, there are a lot of myths out there around healthcare consumerism, or the CDHP plan offering that maybe it only is for the healthy and the wealthy. What is your thoughts around the myths that are out there, and did this study disprove any of those?
Well, a couple things that the study tells us, and one is, in terms of the demographics, one of the myths were that the individuals that were going to migrate to this plan are going to be the young and the healthy. So when we look at our full replacement population, certainly we've solved for selection and everybody's in, and we continue to see good results there. But when we see option situations where there is choice, if you position the plan correctly and you design the plan to be what we call benefit neutral, you will get pretty much the same demographic group in the CDHP plan as you do in the non-CDHP plan. So if designed appropriately, if we have a good communication strategy, if we have critical leadership support, then we find the plans definitely will attract that broad cross-section of the population, and you'll get meaningful adoption into the plan, and you really start to see that trend come down.
Interesting.
We don't really see, the myth is really based on this idea that a high deductible plan is going to only attract someone who's looking for a low cost option. But if you really focus on more of a comprehensive strategy where you're positioning the plan and designing it so that it is going to bring in the chronic care population and your higher spend individuals, because the plan value is set at a place that is close to parity with a traditional plan, you really see very, very strong results.
Now, talk to us a little bit about, the design. You mentioned the design of these plans. Without, what should an employer do, or if I'm a broker trying to get my, clients to move this direction, what do I need to communicate to best show the best plan design without shifting just purely cost with these plans?
So the approach that we take, and certainly this has been very successful over the course of many years now, is that, again, that benefit neutral position or approach is about taking their current enrollment in their traditional plans today and then using a modeling tool that Cigna has to design something very specific for that organization that in the end will produce a cost minus for the employer, but keeps the employees out-of-pocket spend pretty much at parity. And where we see quite a number of winners in the plan, because we also are very thoughtful around the funding, right? So the fund piece is critical, that when you design the plan, that's set at approximately 50% of the deductible.
Mm-hmm. Okay, so
there's certain rules of thumb, or kind of a science around how you set up the plan and position the plan. And I would say that if you start with an organization or an approach that uses some kind of financial modeling tool, so that you factually know that the plan that you're putting in front of these employees is going to be an equal to or better proposition to the employee financially, then you have something that will create a lot of lift first year, so you're going to have less work to do second year, and it's going to have a very positive impression on the employees, so that they'll talk to their colleagues and let them know that they've had a good positive experience under the plan.
Now Anna, we got about a minute left on the program, and want to kind of get your opinion. Where do you see the CDHPs moving in the future, and kind of leave our audience with one or two takeaways on what they need to best understand.
So I think future state, certainly what we're seeing is these plans are really health engagement plans. So we're moving away from, influence simply just purchasing decisions. Now we're moving to, let's create a person who really understands that they have the power to change their destiny relative to their health and their finances. So the plans are going to be more focused around tools and resources and support to, kind of address those two pieces. The other thing is that, that fund amount that's been seeded by employers, we're starting to see employers really look at making that kind of a placeholder for incentivizing individuals to do the right thing. So less free money, if you will, and more incentivized funds. So getting more of a partnership with their employees to activate them, to use the tools and the resources in order to earn those dollars.
Anna, we really appreciate you joining us on the program today. Thank you very much, and look forward to having you back on the program in the future. Have a great weekend. And
you too, Doug. Thanks. I would love to.
Awesome. So everyone, stay tuned for the next segment of Healthcare Consumerism Radio.